Wow, simpler composite restorations and better aesthetics. We're going to spend our time tonight together talking about a really simple finishing technique that can result in beautiful restorations, aesthetics. Then we're going to take a look at a new composite that I really like from Ultradent. And then we're going to go step by step on a class 4, kind of a simple layered class 4. Sometimes, and I've had this experience more than once, where I think I'm doing just a killer job on my class 4, that fracture, and it looks great. I'm under the light, and then the patient stands up in front of me, and I can see that fracture line. And then it's kind of back to the drawing board. So there's a lot of different techniques for this. I think this is a really simple one that works every single time. So interestingly, 300 million direct composite restorations are done every single year. Every single year, 300 million restorations. We're doing a lot of composite, and it's a great choice. It can be very, very conservative. I do a lot more composite than I used to. I used to do, I was kind of like go-to indirect. I'd always be looking to be doing, minimal prep veneers or ceramics of some kind. And now I do so much more composite because we're seeing younger and younger patients that are asking for lots of cosmetic treatment. And it's such a good option for them because it's mostly, it's minimal prep, it's biomimetic, you can get beautiful results, and the new composites can be simple and so easy to use. Kind of a disturbing fact is that the average length of service for most of our composites is only about 5.5, 5.7 years. So we're spending a lot of our time replacing composites, and a lot of us are challenged by getting beautiful composites. And so much of our direct restorations has to do with the bond and the adhesive layer, but I'm going to focus on the other things today. I'm going to focus on the layering, and I'm going to focus on the finishing. So this is something that might look familiar to all of us. I know I see this all the time. And I'm sure I put restorations in like this myself. When we look at the restoration on the left central incisor, I know it's fractured, but when I look at that, I think, how could we do better? How do we get a better result from a situation like that? When I was in dental school, I was taught to restore these with a Mylar strip, right? You put that Mylar strip in approximately, and then you pull it as snug as you can because you don't want any flash. And what happens is it sort of obliterates the anatomy. And when we look at a restoration like this, I think the color match was good. Like, that's not a bad looking color match in that composite at all, right? It certainly lost its sheen over time. And I just think the anatomy might not have been quite right. When we look at, this is our case that we're going to do later tonight too. So a pretty basic case, and I see these all the time. People have little fractures, and I think this was probably restored with a single shade of composite when it was restored. And maybe it was a better match at the beginning, but over time it's picked up some color. I think this restoration is only about 3 years old, and the patient was complaining that it never quite looked right to her. And we all know how focused our patients are on the tiny details of everything these days. We're all sitting in front of these Zoom cameras all the time. Everybody is documenting their lives on social media, and they're taking selfies all the time, right? And this is something that it can be like a huge practice builder for you. If you could do these really well, people come, and we do a ton of these in our office where we're just doing minor composite revision. We do some whitening with it, sometimes some gum sculpting, and it's something I really enjoy doing. So let's get into it. Let's go. So let's talk first of all about anatomy. And I think what was missing from that first tooth we looked at was the anatomy, right? When we look at a central incisor, lateral incisor, even the lower incisors, they all have similar characteristics. We know that they have line angles, right? So where the facial surface turns into the interproximal surface, it actually turns a corner there. So there has to be a physical corner there. If we just have a flat plane, light doesn't reflect off it the correct way, and it just never looks quite right, no matter how great a polish we have and no matter how great a color match we have. We also remember that every central incisor on the facial surface has 2 planes. We've got the plane that parallels the root surface, and then the secondary plane where it tilts down toward the incisal edge. And we look at the lingual of that. We remember the cingulum is there and the marginal ridges on the lingual. On the facial surface, we also remember that every central incisor, lateral incisor, and our lower incisors have 2 fossa and 3 lobes. So we've got the mesial lobe, the distal lobe, and the central lobe, and in between them, we have a fossa. And sometimes we sort of lose that when we're restoring teeth as well. So let's take a look at our patient. Here is the composite restoration that chipped a little bit. This patient came in looking to have this repaired or have it redone. And at one point I would have been like, hey, let's put a minimal prep veneer on that. And I think I could have did a really nice job with it. But you know, it's a couple of things, right? I've got to pay a big lab fee to do that. And it's usually a 2-appointment procedure unless you're kind of milling that yourself, and then milling isn't going to get us that ultra thin veneer that we want. I would probably have put a feldspathic veneer on that, and I would have sent it out to a lab, and this patient would have been in a temporary for a few weeks, and I'd have had a big fat lab fee to go with it. Or we can look at restoring this in composite. But let's take a look at what's not quite right with it. So when we look at the virgin tooth on the other side, the right central incisor, you see that line angle. You see how where the facial surface turns into the interproximal, there is a corner. It's a slightly rounded corner, but it's definitely a corner. And when we look at the restoration that was on the tooth next to it, the left central incisor, no corner, right? So I bet that was done the way I was taught to do it, with a Mylar strip. Put that composite in there, take the Mylar strip, and just really hold it snug against the tooth so there's no flash. And there's something to be said for the no flash, but we also want to accomplish both things, our anatomy and a restoration that doesn't cause any iatrogenic periodontal disease. So we see we're totally missing the line angle on that. And here's our anatomy again, and we look at these teeth and they all have the line angle, and you can see it from the facial, and you can also see it from the incisal edge. So if you're looking at the tooth up from the incisal edge, we're seeing the area where the facial plane turns into the interproximal plane. And then we see the lobes clearly on there as well, that we've got fossa, mesial and distal fossa, and the 3 lobes, the mesial lobe, the central lobe, and the distal lobe. And typically, the distal lobe and the central lobe are about the same width, and the mesial lobe is a little bit less wide. So that's a typical tooth. But in a situation like what we have here, when we have a virgin tooth next door, we really just have to mimic exactly what's going on next door. So we have a pattern to work from. We also want to remember certain things about the anatomy. We want to remember where that height of contour is, especially on the facial. So on a central incisor, that height of contour is going to be in the gingival 1/4. It's going to be about where the planes change direction, the height of contour. We also have a height of contour on the lingual at the cingulum, and we have the contact points that we want to be cognizant of. We want to remember where those are. And central incisors, we know that they are closer to the incisal edge. And as we move further and further and back in the mouth, our contact points rise. They move gingivally a little bit as we move further and further back in the mouth. And the other thing we want to take a look at is surface texture. And I think that surface texture is something that when we look at our really best ceramics, that's what makes or breaks. If you have a beautiful ceramic that, or a ceramist that you love their work, it always has natural looking surface texture. I, again, was taught to polish my composite to within an inch of its life, right? You wanted it to shine like glass, have no surface texture whatsoever. And really, very few teeth look like that. Every once in a while, you'll see a tooth that has almost no surface texture. But for the most part, they all have some ridges in them. And this tooth on the left part of your screen is the mirror tooth to the case we were looking at. So you can see the fossa clearly, and you see the lobes, and that's where the light is hitting on those lobes. You see the mesial line angle. And what you also see is that striation all the way across that surface. The tooth on the right-hand side is from a different patient, but that has some really significant striation in it. That's the natural striation of that tooth. And if we're able to mimic that, we are going to get some killer composite restorations. We see closer to the gingival edge that the striations aren't quite as close together, but they sort of follow the gingival margin, and you can sort of imagine how that enamel was being laid down when that tooth was forming, and it caused those ridges and the striations. But the entire surface of the tooth has that on it. And there you see the fossa, the lobes in between, surface texture, lobes and fossa. Different on every tooth, but usually there's clues as to what you want to do around the restoration you're doing in the mouth. These are beautiful natural teeth, and you see how heavy that lobes are, how heavy the fossa are, and really look at that beautiful surface texture. If we can mimic that, we're just going to kill these restorations. That's what I learned to polish and finish with, discs and finishing cups and points. And oftentimes, or pretty much every time when you use those kind of things, you get composite restorations that are flat with no surface texture and no anatomy. It's really hard to manage anatomy with those types of things. So let's take a look at how we can finish and polish. I know it's a little backwards. I'm starting with the finishing and polishing, but then we're going to work through the composite, and then we're going to do the case. But I use this technique on so many things, and I really think it's a winner every single time. It's super simple. It's very repeatable. And let's take a peek. We're going to finish and polish that. First thing I'm going to do is just touch base with our composite that we're going to use tonight. And this is the new composite from Ultradent. It's Transcend. And the thing that's sort of new about it, and so many companies are making composites that are simpler and have fewer shades, but this one has one shade, a UB, that's kind of like a universal body shade. And you can use it on so many restorations. Like I use this on posterior teeth. I use it on class 3s. I use it on class 5s. Simple by itself. Don't need any layering at all. But it also has some complementary shades that come with it for the anterior cases, which we're going to do in just a moment. It gives you a little bit more opacity in the dentin shades. I think there are 4 dentin shades and 2 enamel shades. So, 6 or 7 composites, and you've covered everything you could ever need. You're also going to see just how beautifully this polishes and how quickly it polishes. So it handles really nicely. It's kind of got that moussey texture that we all really like. I know that's my favorite stuff these days, the composite that feels kind of like light and moussey. And lots of people are heating composites these days. I use this straight out of the ampules and right out of the syringes. I don't heat this at all because I like the handling just the way it is. So the gloss lasts a long time too. I think you'll like it. So you do the majority of restorations with just that one shade, that UB shade, but it also has those other shades that you can use for a class 4 like we're going to do in a minute. Yeah, 1, 2, 3, 4. It has 4 dentin shades, sort of has a little bit more opacity toward them, in them. It has the universal body shade and then 2 enamel shades, the enamel white and the enamel neutral. And I find myself reaching for that enamel white all the time, especially for direct composite veneers. I really like it. Okay, so let's take a look at this finishing technique before we get into the restoration itself. So the finishing technique is you use a flexible disc just, let's imagine we've taken that composite off, we've restored that tooth, it's ready to be finished. And the first thing we want to do is soften out the mesial and distal line angles a little bit. So we're going to take a flexible disc and just soften it out. And this is the only time I use a disc. So we're going to take that disc and just ever so slightly round out the corner on the mesial and the distal. So let's take a look at that. Here is this composite. We've done it. I put a little layering in it, which I'll show you in a minute, but I'm going to take this disc and I don't want to obliterate my corner, but I do want to round it out a tiny bit. It's a little bit sharp. It's a little bit harsh. So I'm just going to take that disc and ever so slightly lay it on the mesial for about 1.5 seconds, flip it over and lay it on the distal. And this is the kind of the interesting part that's maybe counterintuitive to some of us, because we're going to take a coarse tapered flame. That's right, a coarse tapered diamond flame shape, and we're going to spin it dry and slow. So if you have electric handpieces, slow is like 10,000 RPM, and we're gonna use dry without any water on it. And we're gonna take this coarse tapered flame, and that's how we're gonna build the anatomy into this tooth. So we have our composite on there. It's kind of a flat surface, and instead of discs or cups, I'm gonna use this flame to do it. And what I'm going to do is first take that flame and use the shape of it and make the fossa on either side. So I'm going to use it for the mesial fossa and then the distal fossa. And I want to lay it on that tooth. It's going to be a little heavier near the incisal edge because I want the fossa to be a little deeper near the incisal edge. And then I'm going to taper it out up toward the gingival edge. And I want it to stop about 3/4 of the way up because I'm matching the tooth next door. So I've got a tooth next door to look at. And this is actually a picture of the number 8 central incisor next to the number 9 that we were looking at to restore. So I'm going to take that diamond and do the mesial. And then I'm going to take the diamond and do the distal. And I want to be mindful that I'm trying to make the central fossa and the distal, the central lobe and the distal lobe about the same width. And I want to keep that mesial lobe a little bit less wide, a little thinner, and deeper as I get to the incisal edge and tapered out almost to like an infinity edge up near the 1/4 of the gingival margin. So we've got a video, and let's take a look at that. So here's my composite. I have taken my discs and smoothed out the corners a little bit. And now I'm going to take a coarse tapered diamond on my fresh composite. And I'm going to sink it and try to make those triangles. So a little bit deeper toward the incisal edge and a little more shallow as we get toward the top. And it's just a couple of passes like that. So not a ton, just a couple of passes. I'm trying to match that anatomy next door, which has shallow fossas in this case. And then also sort of counterintuitively, I'm going to take that same coarse diamond and then go over the entire surface of my composite. And that's what's going to give us the striation, those little, very shallow, superficial striations across the entire surface of the composite. So we're going to start at the beginning again. First thing, fossa, tapering out, fossa, tapering out, and then across the entire surface of the composite. So the entire surface is roughened. And then to get those kind of deeper striation that are up near the gingival margin on so many of our teeth, I'm going to take that same diamond and I'm just going to flip it onto its tip, and I'm going to go back and forth, back and forth, back and forth across the gingival 1/4 of the composite, but I want to follow the line. I want to follow my gingival architecture back and forth. And you've got to go about 20 times. If you only do 3 or 4 times, it just looks like you've scratched composite. But if you go back and forth, back and forth, back and forth about 20 times, which takes, 20 seconds, then it makes it look right. So start at the beginning again here. Fossa, mesial, fossa distal, roughen entire surface of the composite, and then flip it over, back and forth, back and forth, back and forth, back and forth about 20 times. Try to follow the architecture of the gingiva. And that's what builds our anatomy. I know it feels like that's going to be a super rough composite and not look the way we want, but hang with me for a minute. So we're going to do the coarse diamond, dry and slow. So if you have electrics, that's like 10,000 RPMs without any water. If you're working with air drivens, you can get a friction grip diamond for your slow speed. You can get a friction grip head on your slow speed and do it on that. Or you can get a little adapter that turns any friction grip diamond into a latch, any friction grip burr really, into a latch burr. And you can use that on your latch on your slow speed. And that's the right revolutions per minute. So that's right RPM to get that the way we want it to be. So you don't need to have electrics to do this technique, but better dentistry, electric handpieces sort of go hand in hand. Okay, so we've got the surface all roughened and we've got our anatomy in there, but the composite just looks like, sort of looks like a mess. Universal composite polishing wheels that look like this, this shape. So you see, instead of a cup or a disc, that when you polish with this shape, you're going to polish the superficial composite, but you're not going to get in every single ridge because we want to maintain those ridges. We want to maintain the anatomy. I want to keep the fossas that I built. I want to keep the lobes that I built, and I certainly want to keep all that striation that I built. So we take, this is a universal composite polisher, Jiffy polisher from Ultradent. It comes in medium and fine. This is the medium. We're going to just do a couple of passes with the medium, and then we go to the fine and a couple of passes with the fine. And then this is a Jiffy brush with a little diamond paste on it just to give it its final finish. And we go from something that looks like that to something that looks like that. It has that surface texture. It has the anatomy in it. And if it has too much anatomy, if you say, no, that's too much, like I see toward the incisal edge, maybe those striations are a little too deep for you, then you take that medium polishing wheel and you go over it a few more times and it'll buff it out and it'll soften all that anatomy. It'll really, really tone it down, if you will. But you can get that same light bouncing off it as the same as the surface texture of a natural tooth. So the anterior finishing of the composite, it's a coarse diamond, dry and slow. Then it's a medium spiral polisher. Then the fine spiral polisher, and then diamond paste with a Jiffy brush. And that's not even necessary on this new Transcend composite. I'm only doing the medium spiral composite polisher and the fine polisher now, and you'll see the results. Those are what they look like. They also come in a posterior sort of like broom formation. And you can do a very similar polishing technique on your posterior teeth with coarse diamond to rough out the anatomy and then polish, and it'll be fantastic and really, really fast. Okay. So let's take a look at our class 4 restoration. This patient came to me finishing up Invisalign, and you see she's got the engager still in her teeth, and she was very pleased with her Invisalign results, but wanted more, right? So she wants to do a little bit more, wants to fix things a little bit more. And when we look a little closer at her, this is the patient that I showed you earlier today. You see she's got a class 4 composite on her right central incisor, and she's still got all those engagers on, but she also has a lot of color in her teeth. So a patient like this, I am talking about, as soon as you get those engagers off, let's do some whitening, and then we're going to restore this tooth. So I will whiten her teeth, and I use the opalescence boost a lot in our office. We'll do 2 sessions of boost with a little opal go in between, send her home with a little go when she's finished, and then send her home with a little go in her when she's finished, and then allow her to stabilize. And I'm going to want her to stabilize probably like 2 weeks before I restore this. And then I warn her, this is going to look even more yellow when we whiten, but just hang in there because I'll fix it when we're finished. So 2 week whitening, 2 weeks of stabilization, and then we're going to restore this tooth. And a couple of things that I want to see, kind of notice before we get into this. You see there's a little bit of a black triangle there. And we're restoring so many black triangles these days because they, statistically, 40% of adult Invisalign and adult clear aligner cases end in black triangles somewhere. So it's a great sort of adjunct to put into your practice to restore these little black triangles. And you can use a technique that's similar to the one that we're going to do this class 4 with. The other thing I want you to kind of take a note of is when we look at her left central incisor, that's a beautiful tooth, right? Like you see the dentin underneath there. You can kind of see the dentin lobes. You certainly see a decent amount of translucency, and she has a real halo in there, that incisal edge halo. And we're gonna try to replicate all of this in her class 4 lesion, class 4 restoration of this lesion. And I also want to make sure I don't have any show through, like I can't see the fracture line. So here she is, whitened. She's got her engagers off, or for the most part, you see that orthodontist left a little bit of an engager on her number 7. I think I eventually took that off. We'll look at her afters. But she's got this class 4 lesion here. And already she's starting, her black triangle starting to close a little bit, right, as her tissue matures back into the space. But I want to make sure that I get a beautiful halo, I get that translucency, and I'm able to mimic the lobes and the whole anatomy of that tooth in a beautiful way. So let's take a look at how we're going to do this. Here she is. The first thing I'm going to do is take off all the composite. So all the composite comes off, and I try to do this as minimally as possible, just to get it off. And you see, once I did it, it opened up her opened up a little bit of the black triangle again for her. I'm not going to restore that a lot, because I'm not going to restore that at all this time. I'm only going to restore her class 4, because I know when I put the contact back in that tooth, that we all know that rule, that if your contact point is about 5 millimeters from the crest of the bone, that 100% of the time that papilla will fill back in again. And as that contact point gets further and further away from the crest of the bone, 7 millimeters, I think statistically it's only about 60% of the time it's going to be there. 8 millimeters, we're down to like 30%. The further away that contact gets from the crest of the bone, the more likely you are going to have an open black triangle there. But if we're able to restore that contact point back where it belongs, I am confident that her tissue is going to fill that space in again. So here she is, ready to restore. I've got the composite off, kind of thinking about where I want that contact point to be. And I tell her that when we're done, you still may have a little bit of a dark spot in between here, a little black triangle, but have faith. I always tell them it's going to take 12 to 16 weeks for it to fill in, but usually in about 8 weeks, it's completely back. It's filled in again. So here is sort of the first trick to getting a beautiful restoration. It's going to blend in, and I use these on class 4s, class 3s, class 5s, is that we're going to put a starburst bevel on this restoration, on this prep. And I do it on the facial. I rarely do it on the lingual, because it's hard to do it on the lingual, and I just don't think there's any real benefit to doing it on the lingual. But if we do this on the facial, I can use this starburst bevel to really blend it in. And what is the starburst bevel? It is, I'm taking a coarse flame tip diamond, and I'm going to, we get closer, we can see, I'm going to make an irregular bevel that fades off into the sound enamel. So I'm going to bevel this way past where I would have normally beveled, but at further I get away from the fracture line, the more shallow it gets. And the closer I am to the fracture line, the deeper it gets. So I'm pretty deep on that fracture line. I'm into the dentin for sure. And I am then fanning it out all the way onto the enamel, way past the fracture line, onto sound enamel. And, schematically, it looks a little bit like this. So I want it to be irregular, because every single thing in nature is irregular. And anything we put lines on looks artificial. It just doesn't read to our eyes natural. When we look at this beautiful dentition, everything is curved. Everything has that organic-y feel to them. So I am trying to trick the eye a little bit by blending my composite in a very irregular way. So starburst bevel is how I'm going to start doing them. And then I'm going to isolate that tooth with a little Teflon tape. I'm going to etch way past my starburst bevel, 15 seconds of etch, rinse, leave it a little bit moist, and then I'm going to scrub in my adhesive. And because I'm doing a total etch technique here, I'm going to scrub that adhesive in without the dentin primer this time. This is going to be just a scrubbed in adhesive situation. That's the Peak Universal, and then I'm going to air it off a little bit. So I'm going to scrub it in for about 10 seconds everywhere, and then air that adhesive off and cure it. The first layer I'm going to do, and I'm going to do this without any stent. I'm going to just kind of do this with my finger. There are times I'll make a stent. I'll make a clear stent for the lingual shelf, but you can also do this freehand. And so many times when we're doing these class 4 restorations, you have to do them freehand because they're coming as emergency situations. And we probably all work in a similar way. We have busy practices, and you get an emergency situation, someone has a fractured front tooth, they don't want it fixed 3 days from now. They want it fixed ASAP. So I'm putting them in on my lunch or kind of at the end of the day, and I want to I want to be able to do that from a freehand situation. So a little bit of layering here. We are going to start with the enamel neutral. This is the Transcend Enamel Neutral. And this is the key to making the mesial and distal marginal ridge a line angle and not a swoop. We're going to keep the corner there. So I'm going to use a matrix band that comes from a sectional matrix kit. This is the bicuspid size matrix band from a sectional matrix kit. And it has to be one that doesn't have the holes in it. It doesn't have a tab on it. These work the best. But I'm going to slide it up right inside the gingiva, and I'm going to build the mesial wall with this. And I'm going to use the Transcend Enamel Neutral to build the mesial wall. Then the thing about these matrix bands is they're already contoured to have the proper interproximal shape. So instead of a flat interproximal surface, you're going to get the convexity that's already built into the band. So I'm going to put that band in, slide it up to the gingiva. I'm going to use my finger and I'm going to push it against the tooth next door. And I'm just going to build the mesial wall out of enamel neutral. So I'm going to take a little, we've already etched, right? Put our adhesive on. I'm going to put that composite on and build that wall a little bit. And I want to build it all the way down to the incisal edge. And I'm going to push it into the contact. So I have the contact in the proper place, and I'm going to lean into my band so I get that contour just the way I'd like it to be. So there it is. It's pushed up against the contact, and I've got it as long as I need it to be, or pretty close to as long as I need it to be. And from here on in, it's fairly simple procedure, right? So I'm not trying to hold anything interproximally anymore. I'm going to just start building out my tooth again. So the next layer is more of that enamel neutral. I'm going to take my finger, my gloved finger. Nasser Barji used to say, the best matrix band that God gave you. And he probably still says that. I'm going to put my gloved finger behind there, and I'm going to push that enamel neutral into my gloved finger against the back of the tooth. And we've got etch, facial, lingual, adhesive, facial, and lingual. And then I'm going to push it into the back of that, into the back of it. And I'm going to put a very thin layer. I'm going to leave room to put more layers on this. You can still see the fracture, right? You can see that translucent enamel. And you can also see that that composite is not flat. I'm not taking my spatula and making it flat. I'm going to take the side of my spatula and I'm going to tap, 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 tap it in there until it is variegated. And I'm going to take the side of my spatula and I'm going to pull it up ever so slightly toward my fracture line into my starburst bevel. So I'm dragging that composite up a little bit, but I'm leaving it thin enough so I can put more composite on top. So our lingual layer is enamel neutral. It's a translucent shade, but it's built thin, but with a lot of variegation in it because I want that light to scatter. When the light shines on it, I don't want it to hit flat. I want it to scatter. It's going to help hide. It's going to help hide my fracture line and help me get a better restoration. going to kind of look like that. I'm going to put that variegated composite everywhere. It's going to be dragged up into the starburst bevel a little bit, and it's going to be very, very rugated, very, very variegated, very, very variegated. That doesn't sound right, does it? Okay. And that's what it looks like. The next step, and this is the key to hiding your fracture line, is that you need an opaque white composite. This is my favorite one. This is Vital Essence from Ultradent, opaque snow. It's like the densest opaque white composite that I like to use for this. Like you just need one syringe of this and it'll last you a very long time because you use just a very little bit of it. So I'm going to mix this in with my Transcend and let's see what we do with it. I'm going to take a little bit of that opaque snow and I'm going to straddle the fracture line. So I want some of it to be above the fracture line and some of it to be below the fracture line. And I'm going to push it in, not completely. I don't want a solid line. I want it to go into the valleys between the ridges that I created with my spatula on its side. And I want to pull it up toward the sound enamel and I want to pull it down toward the incisal edge, but I don't want it to go all the way down to the incisal edge. I just want to straddle the fracture line about half below and half above. And it looks like that. It looks sort of blotchy, right? You can see it in there a little bit, and I want it to look like that. And you can see kind of next door on the natural tooth how it looks a little blotchy underneath there too. But this opaque snow is going to hide your fracture line. It's going to scatter the light enough that you will not be able to see it. And I use this opaque snow no matter what color I'm restoring to. So if I'm restoring a dark tooth, it's the same situation. Because on top of this, I'm going to put a little bit of that universal body shade. I'm going to put a little universal body shade on top of this, which works for many, many teeth. Like you can see how well it's going to work here. But, you know, sometimes you do need darker shades. And I'm going to put that universal body shade on top of it. And I'm going to chop in it as well. So now I'm starting to get almost the thickness that I want, but I still have a little bit of room left. So I can put more and another layer on top of this. But I'm going to drag that universal body up toward the sound enamel all the way to the edge of my starburst bevel. I'm also going to drag it down all the way to the incisal edge, but I'm still going to do my choppy motion in there. I still want it to be variegated. Now this is kind of the fancy part. You don't have to do this on everyone, right? I don't do this on every restoration that I do, but it's pretty simple and I like to do it on a lot of them. I want to remember that she's got that translucency in there, right? I just want this to look like, when she's done, I want her to get up and say, this looks just like my tooth. And I also wanted to say, this is so much better than I had before. That's kind of my jam. That's what makes me feel good, that when I'm able to restore it and make it look so much like her natural tooth. So she's got the translucency, and we see that that translucency is forming around the dentin lobes in there. And then she also has a really nice halo. So it's that white kind of line almost right at the incisal edge. So how are we going to do that? So I love this OptiGlaze kit by, this is from GC America. And I use this so often now. I'm staining like printed restorations with this. I stain all my provisionals with this. And you can also use it underneath composite. There's other kits, but this just happens to be my favorite. So I'm going to use this OptiGlaze color kit, and I'm going to use the blue for the translucency, and I'm going to use, there's a white in there, and I'm going to use that for the halo. So the translucency, I take the blue, a tiny, tiny bit, a little bit goes a long way with the blue. You can really get carried away with the blue and go too far. So I recommend that you take it easy with it, just a little bit. So I'll dab it onto the sable brush, and I may even dilute it a little bit with some clear. And then I'm going to just paint the translucency on there very, very lightly. And then you shine the curing light on it. And we're curing between each layer. I don't think I said that. We're curing between each layer. Translucent layer goes on, chop it up with your spatula a little bit, cure it. Put the opaque snow layer on, cure it. The universal body layer on, chop it up, cure it. And then this layer, this translucency and the optoglaze, and then we're going to cure it a little bit. So I'm going to paint the translucency on, cure it, and then the way to get that beautiful halo, the best way that I know how is to take a little bit of the white opaque glaze, the optoglaze, and apply it with a number 10 or a number 15 endo file. So you want to just roll, I drop it onto a pad, I spread it out with a file, I put the file, and you see it's got it on maybe I don't know, maybe a third of it, or maybe almost half of it is dipped in the glaze. And then you just take the file and roll it onto the incisal edge of your filling. Roll it onto that composite. So it's not going to be a flat line. It's not going to be straight, but it will show the way we want it to. It's going to reflect the way we want it to. So then we cure that. And a little more neutral on the top. And then I'm going to put a little neutral on the top. I'm going to use a brush to do it. A composite brush with a little composite resin wetting solution. You want to make sure that when you're using the brush, you're not using adhesive to do that. You want to use the composite wetting, the specific wetting resin, because it's filled. If you just use adhesive, you're going to compromise your composite. No matter what composite you use, you're going to compromise that a little bit. So if you're going to brush and you're going to use a composite brush and you want to dip it in resin, which helps you pull that composite where you want it to go, definitely use wetting resin and don't use adhesive to do that. Or alcohol. Sometimes I see people using dipping their brush in alcohol. That's just that denatures your composite a little bit. Okay. So we've got this completely built, and now we're going to finish it in that same finishing and polishing that we did before. So I'm going to take my disc and just ever so slightly put it on the mesial surface to round out that corner. And then I'm going to take my coarse diamond, dry and slow, and I'm going to build that anatomy in it. The mesial fossa, a little bit under the distal fossa. I'm going to take my burr and go all the way up past my finish line, past where I starburst bevel, past where I put the adhesive on, and blend it in, and we'll blend it right in there really beautifully. And then my medium spiral polisher, then my fine. So you can see that's what it looks like after the medium spiral polisher. It's almost finished. You see the shine starting to come. Then the fine polisher, and you see just how beautifully that shine's coming up. I'm going to just use the interproximal strip a little bit. And then here we are at the finish. And you see we've got the halo, we've got the translucency, we've got the shine. Really can get that anatomy the way we want it to be. Starburst bevel also works for class 5 restorations. Do you ever do your class 5s and you're like, they look pretty good at the gingival edge, but as they're transitioning toward the body of the tooth, they sometimes can look, I don't know, they just can look not quite blended in. They can also look not quite the right shade or the right opacity. So you can use this universal body on class 5s. You just want to, and I did this on a Tipidon so I could film it, but you just want to do that spiral, class 5, spiral, starburst bevel, and pull it out onto your sound enamel. And then you'd run the adhesive in there. You etch way past the bevel. Put the adhesive on. And then one shade of composite, blend it in, pull it through. You can even do it in one step, something this shallow. Pull it all the way through your starburst bevel, all the way out onto the finish line. Class 3s, same situation. Do you not hate when you can see that class 3? Or you get that brown line, you see those brown lines around the class 3s? Starburst bevel is the answer here. We're going to bevel that out. And to restore these, let's see, do we have more of that? We're going to use that same matrix band. I'm going to use the sectional matrix band here. This works so nicely for that. You pull that in, and you see how you can get the anatomy that you want, the isolation that you want, and the interproximal surface, the convexity of the interproximal surface. I'm holding that with my finger in there a little bit, and then I'm going to wedge it. Got to do your whole restoration before you pull that wedge out, right? Because I don't want it to bleed. But you're set to do a beautiful class 3 restoration. I'd use a single shade of composite here. I'd use the UB, etch way past the bevel, adhesive way past the bevel, UB, pull it into the bevel, finish, and polish. Here it is, same technique to do a black triangle. That's just a little bit of the UB in that black triangle area. I use the interproximal matrix band the same way, filled one side and then filled the other. Class 5 restoration. How about a class 2 restoration? This is done with the UB composite. Look at how really that just looks so blends in there so well, can look so pretty in those restorations. Single shade of composite, UB, and then there's the one we did tonight from start to finish. Look at the halo on that. It really can look nice. And there's our patient before, whitening, new restoration on there. You can even see her translucency from this far away. Really, really thrilled and happy about it. And that's a practice builder for us. There's some contact information. I'm going to take a look and see if anyone has any questions for me. Pop them up in the chat box if you'd like to. We have a few minutes. Do I recommend a plastic or a wooden wedge? I'm a plastic wedge girl. I don't like I don't do the wooden wedges at all. I don't know. I like those wedges. I think they're the Triodent wedge that has it looks like a feather. I think those work really nicely. And they are also super flexible. People are always asking me too about how often or how soon after someone does whitening can you put the adhesive and the bonding on there. I think most of the research is saying you should wait a couple of weeks after whitening, after that peroxide's been on the teeth. So I do 10 days. So we do 10 days in our office. They finish whitening. 10 days later, we allow them to color stabilize. So during that time, they're stabilizing their color, and their enamel and their dentin is returning to whatever its natural makeup is, and we don't have to worry about adhesive issues with that at all. For us, whitening in our office is always a 2-appointment procedure. We do one session of Opalescence Boost. I send them home with some Opal Go, three trays of it. They do come and do a second session of Opalescence Boost, and then 3 more days of Opal Goes. We use the 15%, and I think they only make mint now. I only use the 15%. But if you do 2 sessions with a little whitening in between and a little whitening after, you get really nice, long-lasting results. So we'll do that, spread it out. That's about a week, maybe 10 days of whitening total, and then we stabilize for 10 days, and then we're good to go on our composite. Somebody asked here about Transcend sticking to the composite instruments. I use wetting resin, but still can't get it to do what I want. Do I have composite instruments that I recommend? I actually do have some composite instruments that I love. They are called, let me just think, LM Art, ARTE. But I find that this Transcend is probably the least sticky composite I've ever worked with. And I use it on lots of different instruments, but the LM Arts are really nice, and I like them because they're so thin and flexible, and you can do that chopping with them, and they're just so they just feel so light in your hand. I just really like them, and nothing sticks to them at all. They have these new like hard diamond ones that nothing sticks to them. But a little bit of wetting resin goes a long way to making none of the composites stick to your instruments. But I think that you'll like the Transcend. It's really handles really beautifully, and you saw how that finish just jumps alive. Can we have the name of the polishing wheels and brush again? The polishing wheels are Ultradent universal polishing wheels, fine and medium. And the brush comes from Cosmodent, and it is an autoclavable handle with disposable tips on it. The Ultradent wheels are autoclavable. So they come, they come, I think you can get them in like a kit with one of each and a broom of each, or you can just order them in refills. And I'd say I get, oh my gosh, I bet I get 20 uses out of each of them easily, because they're really, really durable, and they you don't need a lot of polishing. The polishing technique is very light, and they last a really long time. So we use autoclave, and I'm going to say 20 times before I have to break open new ones. How often do you recommend whitening? Can it be done every 6 months, and does it affect enamel in the long run? I tell people that when we whiten people, we say, once you're finished with this whitening, if you don't do anything at all, it will take about 5 years to get back to where you are now. Slowly over time, your teeth are going to relapse, depending on your habits. People that are smokers, that are wine drinkers, that are cigar smokers, that eat a lot of staining food, that have darker teeth to begin with, they're going to relapse faster. But we tell people that we like them to touch up about once a year. So anytime we do anterior work, you're doing composite work like this. The nice thing about this composite work is even though if the teeth fade off a little bit from the whitening, because of this technology inside the Transcend composite, it still will match. You're not going to get a color shift like you saw at the beginning of that case. The color will hold for a long time. It has a quality where it sort of camouflages into whatever the color of the tooth is. So, but when we're whitening people, I tell people slowly over time, your teeth will relapse again. And I recommend that you touch up once a year. So you can either use a product at home, like we stock Opal Go in our office, and we sell a ton of it. Every other 6 months, we'll sell them a kit of Opal Go to use at home, or we have them stay in our office for a touch-up whitening session. And that is like a 40-minute session. We use Opal Boost. We isolate their teeth and gums and boost them with the Opalescence Boost, which is the 38% hydrogen peroxide boost, right? Gel. We'll do 2 20-minute sessions. So 40 minutes they stay, and every other time they get their teeth cleaned, they pre-schedule. I'm going to stay for my whitening, my touch-up whitening. They'll get their teeth cleaned. The same hygienist will isolate them, and then she'll bounce to a next chair. She works out of 2 chairs to do that. So it works really nicely to keep them on track, to keep them for their hygiene appointments, and it's a nice income for the hygienist chair. How do I make sure I don't adjust off the white halo I created when adjusting? So that white halo is sandwiched. So you want to make sure that your length is pretty close to where you want it when you put that second to the last layer on. Then the white halo goes on top of it, and then we put a little bit of enamel on top of the halo. So theoretically, it should be underneath that little bit of enamel neutral. And it should be pretty close to the length that you want it to be. So you want your length to be, and you can even adjust your length to where you need it to be before you put that halo on. But that halo has to be really light like that. If it's too thick, it just looks wrong. It just looks man-made. It looks like someone drew a white marker inside somebody's tooth. That little halo off the endo file is all you want it to do. Which wetting agent? That Ultradent makes one. It's called resin wetting. Might just be called resin wetting. Comes in a syringe. How would I finish closer to the gingival third if it's a large class 4? I'm going to finish the same way. I'm going to finish with my rough diamond I'm going to polish right into whatever sound enamel I have, and then medium wheel and fine wheel. Okay, I think we're going to have to wrap up for tonight. I really appreciate everyone being here. Thank you all for your comments, and thank you for attending tonight. That's my contact information if anyone wants to get a hold of me for any reason. I hope you all have a great night. Take care.